Can you just do a quick refresher on the promoting interoperability category?
Great question, Bridget. Let's just say it's all about the use of certified EHR technology, or CERT. PI is one of four MIPS performance categories. A PI score, that is a promoting interoperability score, typically contributes 25% of the final MIPS score, except in cases of reweighting. Practices and providers can be eligible for an exception for any one or multiple of the performance categories. Now, exception means that you get forgiveness for not reporting that category. The weight that that category carries into the MIPS score gets redistributed to the remaining MIPS categories that the submitter is responsible for. So PI can go to zero if a provider or practice has an exception for PI, or PI can be increased if one or two of the other categories have exceptions. So the score that would go to those for the total final MIPS score would be redistributed to PI. Now there are four objectives captured in PI measures, and there's an overlay of required infrastructure attestations, almost a fifth objective, if you will. So the required infrastructure attestations to get a PI score every year, you have to declare that there are no actions taken to limit or restrict interoperability of CERT, and that you've made an annual review of the high priority practices safer guide published by the ONC. And you make an ONC direct review attestation that you're available for ONC to directly review issues in your CERT, and that you've done an annual security risk analysis. So those are the baseline infrastructure attestations, and they're constructed to the right answer is yes for each of those. And then there's four measure-based PI reporting categories. The first is e-prescribing. The second is health information exchange, essentially that goes with patients in the case of sending or accepting a referral. There's provider to patient exchange of data, and there's exchange of data with public health or clinical data registry in your region. And there's a variety of ways in each of those categories to meet the category objectives, and there's also a variety of exceptions to each of those categories, and as I said, options to meet the requirements. So that you can get that data directly from Medicare or in other. We won't go into the deeper detail on that in this setting.
I also just want to call out, in previous years, practices have been able to attest no to some of those required infrastructure attestations. In 2024, could a practice still earn points if they attest no?
Great question. You're, I think, referring to specifically the safer guide question. And for the first year or two that safer guides was in this list, just being aware of them, just saying yes or no was fine to meet that attestation. Beginning with the 2024 submission year or performance year, that answer has to be yes, that you read it.